Acute appendicitis. Etiology of acute appendicitis is obstructive cause and non-obstructive cause. Obstructive cause is fecolith, most common pinworm tumor. Non-obstructive cause is submucosal inflammation and mucosal inflammation. Clinical features. Most common presentation is pain in the right iliac fossa. Pain starts around the umbilicus and radiates towards the right iliac fossa due to same nerve supply. Murphy's triad. Murphy's triad is pain, vomiting and fever. Signs are Delavaux sign or triad, which is rebound tenderness in the right iliac fossa, guarding or rigidity, and hyperesthesia. Clinical testing by Rovsing sign. By pressing the right iliac fossa, there is increased pain in the right iliac fossa as bowel loops gets displaced. Blumberg's sign, tenderness and rebound tenderness at the McBurney's point. Next is Cope's test to differentiate the position of appendix, Cope's psoas test for retrocecal appendix, and Cope's obturator test for pelvic appendix. For retrocecal appendix, psoas muscle become taut on extension of hip and knee. There is increase in the pain. Cope's obturator test for pelvic appendix, internal rotation of the thigh, obturator muscle become taut, there is increase in the pain. Baldwin's test, retrocecal appendix, legs are lifted off the bed on extended knee, patient complains of pain in the flanks. And hyperesthesia of Sheeran's triangle. Sheeran's triangle is formed by umbilicus, pubic symphysis and anterior superior iliac spine, and on PR examination show rebound tenderness in the right side of the rectum and Dunphy's cough tenderness sign. Scoring of the appendicitis is clinical scoring, Alvarado scoring and Tazanki scoring. Alvarado scoring, mnemonic is Mantrales. Symptoms are migratory right iliac fossa pain, score 1, anorexia, lack of appetite, score 1, nausea, vomiting 2. Signs are tenderness in the right iliac fossa, score 2 if it is present, rebound tenderness and elevated temperature. Investigations, leukocytosis and shift to left, that is increase in the neuroblastoma or immature cells. 2 and 1 scores are respective. Total score is 10. Interpretation is, if a score greater than or equal to 7, there is highly suggestive of appendicitis, and 5 to 6 doubtful or require further evaluation. Less than 5 unlikely of appendix. Tazanki score, tenderness 4, rebound tenderness 3, leukocytosis 2 and ultrasound 6. Total is 15. Here greater than 8 suggestive of acute appendicitis, less no appendicitis. Investigations are CBP and peripheral smear, increased leukocytosis, shift to left, CRP, C-reactive protein, marker inflammation, ultrasound abdomen to rule out other conditions, CT scan. Laparoscopy is useful and powerful method. Treatment is golden period within 1 to 2 days, grid iron incision or muscle splitting incision connected at the McBurney's point perpendicular to the spinal umbilical line. Layers to be separated are skin, deep fascia, external oblique muscle, internal oblique muscle, transverse cervical muscle, only splitting incision, and peritoneum. Rutherford Morrison's incision, same as grid incision, but this is muscle cutting incision. Lance crease incision, transverse crease 2 centimeters below the umbilical line, crease 2 centimeters below the umbilical line at the mid clavicular line. And right paramedian incision, this is the right paramedian incision and a laparoscopic approach. Procedure is under general anesthesia. Skin is incised, 2 layers of superficial fascia are cut, external oblique aponeurosis is open in the line of incision, internal oblique and transverse muscles are split in the line of fibers. Peritoneum is open in the line of incision. Cecum is identified by tinea and ileocecal junction. Omentum when adhered is separated. Appendix is held with Babcock's forceps. Mesoappendix with appendicular artery is ligated. Using thread or silk, a purse string suture is placed around the base of the appendix. Base of the appendix is crushed with the artery forceps. You transferred using vicryl. Appendix is cut distal to the suture ligature and removed. Stump is cleared with antiseptic. Purse string suture is tightened so as to bury the stump.